Welcome. Today's topic is insulin. In this video we are going to discuss these topics on insulin. What is insulin? Insulin structure, actions of insulin, synthetic insulin, production of human insulin, insulin types, adverse effects and finally sites of insulin injection. What is insulin? Insulin is a hormone produced by beta cells of the pancreas, and it is considered to be the main anabolic hormone of the body. Insulin is a polypeptide hormone. Insulin structure. Active insulin has only two chains named A and B. A chain has 21 amino acids. B chain has 30 amino acids, and the two chains are joined with sulfur bonds. With joining chain C, the whole chain is called pro-insulin. Only A and B chains together called human insulin or active insulin. Actions of insulin. Main action of insulin is regulating the metabolism of carbohydrates, fats and proteins by promoting absorption of glucose from the blood into the liver, fat and skeletal muscle cells. Here, this slide states the main four actions of insulin in brief. Number 1. Reduce blood glucose by improving glucose uptake by tissues. Here, you can see, insulin binds insulin receptors to open up the glucose channels and to get in glucose to the cells from blood. Number 2. Stimulate the storage of glucose in the liver as glycogen, and in adipose tissues as triglycerides, and the storage of amino acids in muscles as protein. Glycogen is a polysaccharide, and this process of new glucose formation is called glycogenesis. Number 3. Promotes utilization of glucose for energy. Number 4. Inhibits the breakdown of triglycerides, glycogen and protein and the conversion of amino acids to glucose. This process is called gluconeogenesis. Synthesis of glucose from non-carbohydrate compounds is known as gluconeogenesis, and the liver supplies sugar or glucose by turning glycogen into glucose by glucagon hormone in a process called glucogenesis. Synthetic insulin. We have only insulin injections. Insulin is a protein and cannot be given orally because it would be digested. That means inactivated by gut enzymes. Insulin is injected subcutaneously during day-to-day use. We have insulin solutions with 100 units per milliliter and vials with 10 milliliters and cartridges of 3 milliliter to be used in pen devices. For subcutaneous injections, normally above 26 gauge is suitable. And now in pens we have very thin needles like gauge 30. Higher the gauge number, finer the needle. Species of insulin production. Human insulin, pork or porcine insulin, beef or bovine insulin. Animal insulins are no longer used. Amino acid sequence is different between human and animal insulin. Human insulin lowers blood glucose faster than animal insulin. Animal preparations can be immunogenic or allergy. Porcine insulin is very similar to human insulin. Therefore, immunological reaction is rare. All type of insulins are highly purified. Production of human insulin. Human sequence insulin may be produced semi-synthetically by enzymatic modification of porcine insulin or biosynthetically by recombinant DNA technology using bacteria or yeast. But now enzymatic modification is not used. Technology is recombinant DNA technology. Here from this technology we can find three types of human insulin. Human insulin CRB means chain recombinant bacteria. That is done by binding A and B chains that have made by using bacteria. Human insulin PRB means pro-insulin recombinant bacteria, and human insulin PYR is pro-insulin, yeast recombinant or precursor yeast recombinant insulin. Recombinant DNA technology. As in the picture you can see scientists build the human insulin gene in the laboratory. Then they remove a loop of bacterial DNA known as a plasmid and insert the human insulin gene into the plasmid and return the plasmid to the bacteria and put the recombinant bacteria in large fermentation tanks. Then the recombinant bacteria use the gene to begin producing human insulin. Scientists harvest these insulins from bacteria and purify to use as a medicine. Minimizing the injection pain. Here are the few tips to reduce insulin pain. If you can, make sure your medicine is at room temperature. Wait until the alcohol you use to clean where you're going to inject is dry. Always use a new needle. Get the air bubbles out of the syringe. Make sure the needle is lined up right going in and coming out. Stick the needle in quickly. Insulin types. We can classify insulin as solutions as well as suspensions to prolong the action. Two types of insulin as solutions are soluble insulin or regular insulin. We call them R-insulin too. Other one is human insulin analogs. We have insulin zinc suspension or lente and isophane insulin as insulin suspensions. NPH means neutral protomenhydrin, a type of isophane insulin. Insulin solutions are colorless clear solutions. Regular insulin is short-acting and analogs are rapid-acting. Regular insulin is taken 30 minutes before meals, 6 or 8 hourly. And insulin analogs must be taken immediately before or after meals. Normally regular insulin is given subcutaneously in day-to-day routine. Intravenous route is used in diabetic emergencies like diabetic ketoacidosis, hyperglycemia and perioperatively. Only 30-min action is there. Intramuscular route is used only in hyperglycemic emergencies if facilities for intravenous infusion are not available. Human insulin analogs normally given subcutaneous. Intravenous in emergencies only. Lente is made by mixing semi-lente and ultra-lente. Semi-lente is made by mixing soluble insulin and zinc powder. Ultra-lente is made by mixing soluble insulin and zinc crystals. Semi-lente is called amorphous insulin zinc suspension. IZS. Ultra-lente is called crystalline insulin zinc suspension. CIZS. Ratio of mixing to make lente is 3:7 in an acetate buffer. Isophane insulin is made by mixing protamine to soluble insulin. Protamine is added to prolong the action. Lente is long-acting and isophane is intermediate-acting. Both are given 1 hour before meals. Lente, semi-lente, ultra-lente, all are turbid color suspensions. Isophane is cloudy. Lente is a biphasic insulin and isophane is monophasic. Examples for human insulin analogs are insulin aspart, insulin lispro, insulin glulicin. Insulin suspensions are given subcutaneously, not in IV use. In past, hospitals had only R and lente. Doctors mixed lente with soluble insulin. First R insulin should be drawn into the syringe and thereafter lente. If lente drawn first, particles will contaminate with R insulin. If that R is given IV, the patient will die. When considering isophane insulin, not permitted to mix soluble or rapid with isophane insulin in a syringe. Because pH will differ. Use only pre-mixed ones. Soluble insulin onset of action, within 20 to 30 minutes. Peak action, 1.30 to 3.5 hours. Duration, 6 to 8 hours. Rapid-acting insulin, onset of action, within 15 minutes. Peak action, within 90 minutes. Duration, 2 to 5 hours. Rapid-acting insulin has faster onset and shorter action than soluble insulin. Adverse effects. Hypoglycemia, weight gain, growth promoting, local reactions or lipodystrophy like lipohypertrophy, lipotrophy, insulin resistance. And a resistance have to increase the requirement and need higher doses for insulin-resist patients. Delay the onset of action in a resistance. Insulin allergy will occur rarely. Sites of injection. Upper arms, abdomen, upper thighs, buttocks. Change the area of injection once a month. Thank you for watching. Hope you guys enjoyed. See you in the next video.